at Kearney Physical Therapy, and we're going to be talking about the NICU because September is NICU Awareness Month. I'm Mackenzie, an occupational therapist, and I'm certified in neonatal touch and massage.
I'm Emily. I'm a physical therapist specializing in pediatrics.
And I'm Shelby, an occupational therapist also specializing in pediatrics.
So when we say that we're therapists working with babies, they usually think, what do we do with them, especially within the NICU? Well, these are kind of 7 protective measures that we're helping parents understand in order to help their babies to grow. And we'll kind of go through them a little bit. So the first one is the healing environment. And so providing that healing environment, we're helping the parents understand what they can do to give that positive touch. Did you know that less than 5% of touch is positive within the NICU?
And as little as 2 minutes or up to 15 minutes of skin to skin prior to procedure can decrease pain.
Yeah, so as therapists, what we're doing is we're helping the parents understand how to pick up their babies and put down their babies while providing that skin to skin and teaching them all the different benefits that skin to skin really has. So with it having that healing environment and making sure that the lights are correct and making sure that it's not too noisy in there, we're really helping the babies just grow. And we're also preventing or minimizing the pain, which is our step number 5 there too. So the environment setup really helps the babies to understand what's all coming in, and every time we touch the baby, we always want to make sure that we're kind of talking to them before we touch them and touch them before we do anything with them, so they're not like, wow, what's all going on over here? Okay, the next thing that we like to do is we really like to partner with the families. The families are the constants in the baby's life, so that's what we need to be teaching the families, because we're not going home with these babies after they get discharged from the NICU. So how we help the babies is we're going to help them to understand the baby's language or the baby's cues. So Emily, what sort of things might this be when, like, the baby's cues? What might they show us if they're stressed out?
So they're going to splay their fingers, they're going to go into extension, they're going to give you all sorts of signs that are saying, please stop, this is enough.
Yeah. Or else they might give you, if you're rocking them, and they might be like cooing or just like looking at you with a nice alertness. That's telling us, hey, I'm okay with this. You can go ahead and keep going. So helping the parents be comfortable with it and understand if they do get to that splaying of the hands, to provide that those touches to help them get in that more comfortable, relaxed state again. So, and that touches maybe that firm and gentle pressure that they might do. Maybe you're working with the nurse and the nurse is helping them change their diapers, so you can provide those hands on the baby that helps the baby feel like, hey, I'm still in mommy's womb. I still feel really comfortable and safe and not like I'm just out in this new world. What's happening? Okay, the third thing that we do is we help a lot with positioning and handling. So we're helping the parents understand, once again, how to touch, how to hold, how to position their babies in the most safe and supportive ways. And what's really neat and what I'm certified in is that infant massage, and that is such a cool way for the parents to learn how to bond with their child and to help with all of their systems so they can ultimately grow again.
And we work as a team with the nurses and other caregivers to make sure we're changing position and providing boundaries to help prevent any head shape or muscle tightness, because we want their head to form as symmetrical and best that it can.
Absolutely. All right, the next thing we do is really safeguarding that sleep. Babies really need that sleep in order to grow. If you look at a baby's head at 35 weeks, it looks really smooth, their brain does, but if you look at it at 40 weeks, it has all those bumps and those contours in their brain, meaning that their brain has really grown so much, even over those last 5 weeks that they were supposed to be in the tummy. So by safeguarding the sleep, we're helping that brain to just grow and make all those connections that it should be doing. So that also relates into teaching the parents what are the safe sleep practices. Because in the NICU, we might be putting the babies on their bellies. We might be putting them on their sides. Well, at home, we all know the back to sleep policy is making sure that they're back to sleep with nothing else in the crib. So helping parents understand that. And another thing that we do here too is we really refer out to the community resources before they're going home too. So we help the parents understand, you know what, you've done all this work in here, your baby's doing really well, ready to go home, but we want to stay on top of things because therapy is such a preventative service within the NICU. So that is our biggest goal, is we want to prevent any other further delays or anything that might happen, because premature babies are a little bit more prone to some areas that they might need to work on a little bit later. So helping the parents understand what resources are out there in the community so that they can be assured that their baby is on the right track for life. So within the outpatient, what are you kind of hoping to get babies that are in the NICU back to make sure that they're meeting their milestones?
So we'll look at where they are, and we really look at their age, their adjusted age. So if they were born a month early, you're looking at, if they're 3 months now, you're looking at what skills they should be doing at 2 months. And we try and work towards getting age appropriate by around 2 years, but we kind of look at where they are and where they should be and try and give you ideas and ways to continue to help that development, whether it's their gross motor, where they're rolling and crawling and walking, or fine motor, how they're working with objects and moving their hands, or with speech and language and swallowing, things like that.
Okay, the next step that we have is the 6, and that is protecting the skin. So the baby's skin is a lot more permeable, meaning that things can go through it. So we want to make sure what we're applying to the skin is beneficial to the skin. And also, this is where we teach the parents how to do things like swaddled bathing. Every baby needs a bath, right? So when we help them to do what's called a swaddled bath, that technique helps to decrease the amount of heat that's going to be is lost during the bath, and then it also helps the baby to just stay comfortable and content. So the less crying means the more growing that they're doing. Then the last thing that we're doing in the NICU is really optimizing that nutrition. So we're going to be first recognizing the cues when the babies are going to be ready to start eating, and then we're helping to maybe do some oral motor massage to help those muscles kind of wake up in their face and on their tongue and in their cheeks, and how to help them to really suck. We might be suggesting to the parents to hold their baby a little bit differently when they are feeding the baby. You know, a lot of times they get really cuddled up and they just want to go back to sleep if you hold them like this. Well, if you hold them out, then that helps them to stay a little bit more alert, and you can kind of see what's going on when they're feeding better. We also might suggest that they try a different nipple on their bottle, or you know, let's say they're not to that stage yet and they just have that nose or that tube in their nose that's going down to their bellies, and that's where they're getting their food. We might suggest to them, hey, if you put a little bit of breast milk on that pacifier and give that to them when they're getting that food in through their nose down to their tummy, their mouth is saying, I'm getting full, and their tummy is saying, I'm getting full, and so that's helping them put that connection together. I need to suck in order to get my belly full and feeling good. So ultimately, as therapists in the NICU, our goal is wanting to make the parents come back and be with their child. So it is so important for the parents to have that personal interaction, and once again, it's not what we're doing, it's really what we're doing to help the parents take care of their babies. So studies have shown that babies that have had therapy within the NICU have been weaned off of oxygen earlier and develop more mature eating skills, which essentially leads to a faster discharge or getting released from the hospital sooner, which everybody's looking forward to get home. So we have a really unique experience because Shelby actually is a NICU mama.
I am. So we talked about, I'd just like to share some, I think, really important pointers for moms and parents as your baby's in the NICU, from my experience and from a therapist standpoint on what's the most beneficial. So I think one of the key points is like finding that balance in your life, because a lot of people have other babies, or even if it's just you and your husband and life itself, and figuring out balancing your time between the baby and the NICU and your husband or other children, and then also taking care of yourself, doing those special things for yourself, you know, if that's going for a run or working out or just taking an hour away from the NICU or whatever it might be that helps you kind of decompress from the stresses that the NICU can have, because it's not easy on anybody, no matter how short of a stay you're in there or how mild whatever your baby's going through is. It's very stressful. I also found that it being very important to try to understand what your spouse is going through, because a lot of times you're thinking about your baby and this or that, and you're not always thinking about each other. So I think that's very important. Also letting go of any guilt that you might have for whatever's going on, whatever happened, whatever it was. It's not anything that you can change or you could have changed, and just looking at what you can do to help support your baby now and to support your husband and your other children, and do the best that you can in that environment. Also advocating for your baby, I think, is a huge thing. For us, that started with like being able to hold and do those things, you know, pushing for what you felt was most important at that time when they're stable, and advocating like for therapy to help you or nursing to help you feel comfortable to get your baby out of their isolette or their bed, whatever it might be. Because studies found that interaction is so beneficial for the baby, but it's also beneficial for mom and dad too, to have that interaction with their baby early on. Also with like different routines, like we've talked, there's different bath time routines you can try that, if nursing is suggesting something and you feel that it's too stressful or, you know, it's hard on your baby, it's okay to say that, and to express that to nursing or the doctors, because most of them will take that into consideration and they'll adjust things to you and your baby, because the doctors and nurses are there to care for your baby, but in the end you're their parent and you know what's best for them, in any situation. Let's see, and then also fully understanding the benefits of therapy during the NICU and then after, I think can be very helpful. So you know how to help stimulate your baby at home, but also like the outpatient services that they offer to kind of check those developments takes that stressor off you a little bit, to feel like, okay, are we where we need to be, or do we need to be doing more? That's what the therapist is there to help kind of give you intervals along the way of, okay, now work on these things, okay, now work on these things. And like Emily kind of talked about, you know, it's totally normal for your baby to be checked at the adjusted age. So, you know, say they're 3 months, but they're born 4 weeks early or 7 weeks early. We want to look at them at those developmental skills with that adjusted age, not their actual age, because those first few weeks, like we're in the NICU, all we're really focusing on is that brain growth and sleep, and to kind of help them grow and develop like they would have if they were still in the womb. So I think those are some really big things that are hard for people, because you want to do it all and you are stressed because of the NICU, but there's some big things that you need to do to take care of yourself before you can take care of your new baby.
Thanks for that personal insight. So overall, we just want to express our gratitude to the nurses and the doctors that allow us to come into the NICU and see these babies, because we understand that each and every baby is truly a miracle that's happened, and we just really want to foster the best growth for that child. So thanks for letting us teach you a little bit about what it is to be a therapist within the NICU. The first point we want to talk about is a healing environment. So your baby is taking in everything, whether that's the lights coming in, whether that's all the sounds. We want to make sure that it's set up, that it is really like the womb, and that it's being that protective measure. I want to redo this again.
It's okay,
Just
just
keep going. Okay. The first thing that we want to do is set up a healing environment. So our baby is taking in everything. You know, it's taking in all the sounds, all the beeping. It's taking in all the lights, whether that's really low light or really high light. We want to make sure that it is like the womb, and we want to make sure that it's just not going to be stressing the baby out, that they're nice and comfortable. Did you know that less than 5% of touch within the NICU is positive? So that's where we're coming in, and we're teaching the parents how to provide that positive touch, and we're going in and also providing that positive touch so that the babies are able to not react when something is coming at them, that they know that it is going to be healing and not hurting.